All right, in this video, we're going to be going through the manual muscle test of rhomboid major and minor. We're going to be testing both of them at the same because they have the same actions and work together. So for the actions of rhomboid major and minor, again, due to their fiber direction discussed in our palpation video, the fibers are primarily going to allow for the number one thing being retraction, slight elevation, and then again, downward rotation. But in a simpler term, while the scapula and the arms are rested at their side, if you ask the individual to squeeze their shoulder blades together, this is retraction in a downwardly rotated position. So some retraction together and even a slight bit of elevation will be rhomboids. Now he is activating some of his trapezius, however, we are not going through upward rotation, which would be more of a upper and middle trapezius action. So for the break test component of it, I'm going to ask my partner to raise his shoulder up. We're just going to do one at a time. So let's go back down for a second. If possible, just this shoulder. Excellent. I'm going to brace on the opposite side. I'm going to find his spine of the scapula on this side. I'm going to place the palm of my hand on his spine. I'm going to try to push his shoulder down towards the table in protraction. 5, 4, 3, 2, and 1. Good. We're going to relax the shoulder. I'm going to keep my same hand position. So again, along the spine, put your palm down on it, and then ask him to nice and slowly retract the scapula. Bring it together. Go ahead and squeeze all the way up. Good. And that's going to be our concentric contraction for it. And we're just going to change positions and we will go through the length position. Now that we have our partner in a seated position, we're going to be going through the length position for the rhomboids. Again, because they do elevation and retraction primarily, we're going to be focusing on doing more of a protraction and holding the scapulas down. In this video, we're basically going to try to focus on one, but I will be doing bilateral because it's very, very challenging to push on one because otherwise the whole torso is going to rotate. So I will be doing a bilateral rhomboid lengthening position for this. So what I'm going to be doing is landmarking fairly close to what is known as the acromial angle along the spine of the scapula here in the acromion. I'm going to place my palms on both of those. I'm then going to ask him to gently slouch and kind of round his back. Good. And now I'm going to try to push those scapulas forward and towards the table a little bit. So if we bring him out of the slouch position into a standard position, this would be neutral. Or oftentimes when people slouch, they automatically go into a slightly protracted position. So you might not see a lot of length gain here because a lot of individuals are already long through rhomboids and middle trapezius. So again, one more time, cupping that and pushing gently forward. So my direction is this way. That's going to be the length for rhomboid major and minor.